how to improve the results in assisted reproductive technology procedures. That means fertility treatment procedures. How to improve? So, there are so many ways in improving the result in assisted reproductive technology. We give medication for a certain period. After that, the medication will not be helpful. So, we can do IUI procedure. In IUI, what we will do? We give certain drugs and certain injections, and we will do some certain ultrasound procedures, ultrasonography, and then we will come to know how many eggs are growing. 1 egg is growing, 2 eggs are growing, no eggs are growing. And after that, after the 12th or 13th day, we give one injection for the rupture of the egg, gonadotropin injection. Afterwards, we will do intrauterine insemination of the husband. When we do IUI, if the husband is having little less spermatozoa or sometimes unexplained infertility, if the both wife and husband reports everything is very normal, but they are not getting conception, so first line of procedure to enhance the fertility treatment options, we do IUI, that is intrauterine insemination. Sometimes if the patient is having less eggs, AMH level is very less, suppose it is less than 2, less than 1 or whatever it is, then or 2 times IVF or IUI procedures are failed, 2 times IVF procedures also failed, if the age is more, then we will try to enhance the result by doing ICSI and also blastocyst transfer. What is blastocyst? After preparation of the embryo, after fertilization, that is the egg and ovum and spermatozoa, they go for fertilization. After the preparation of the embryo, usually in ICSI procedures, 3rd day will be the embryo transfer. But sometimes to enhance the result, we do blastocyst, we create the blastocyst. So, we do culture up to 5 to 6 days, and then whenever the blastocyst formation occurs, then we do transfer of the blastocyst. It gives you very good result. And we do ICSI, we prefer ICSI than IVF. Why? To enhance the result, to enhance the fertility rate, to enhance the embryo formation rate, to enhance the result. Embryo transfer, after that, after embryo transfer, implantation result. And again, what other procedures? Sometimes we do IVF or ICSI with the own eggs, we prefer that, and afterwards if 2-3 cycles, if they are not getting the good result, if they are not getting the implantation properly, if they are not getting the good embryo inside, like ultrasonologically we don't find the proper growing fetus, or if there is any abortion, then we prefer doing oocyte donation, that is egg donation. We select a proper fertile donor, very young proper fertile donor, we take the eggs from them, and then we prepare the embryo with the husband's spermatozoa. We do the thing and we do fertilization. After embryo formation, we transfer the embryo into the uterus of the own mother. So, you may have so many doubts about how we can use the egg from the other lady. Yes, in the embryonic stage level, actually there won't be any problem, and the formation of HLA antibodies will not occur in the embryonic stage. So, we can utilize the egg, we can utilize the sperm, we can utilize the embryo, whatever it is, and because it is the embryonic stage, then there will not be antibody. So, any reaction will not occur in the womb or in the blood supply. So, the process will be very normal and there won't be any effect to the female or male, whoever it is, for the female implantation. How to improve the egg count in the ovary? So, recently we are utilizing platelet rich plasma. We take some blood from the patient and we prepare the platelet rich plasma, and very small quantity we prepare, and by doing certain molecular biology techniques, and all. Afterwards, small quantity of the fluid, platelet PRP plasma, platelet rich plasma, and we introduce this into the ovary, and we will wait for 2 or 3 months, and then the egg quality and quantity will become little better. This also we can do for the enhancement of fertility. And we sometimes do hysteroscopy and laparoscopy to enhance the results. How hysteroscopy enhances the result? See, suppose if there is any polyps or fibroids or any adhesions in the uterus, inside the uterus, if the blood supply is very less, if there is any infection, previous necrosis, and if there is any problem, if there is any other problem, maybe the tuberculosis or whatever it is, then we will come to know after doing the hysteroscopy, and we put the treatment for that. We clear the problem, we enhance the blood supply. All these things will be happened after we come to know the microscopical procedure called hysteroscopy procedure. That is the microscopy procedure. We introduce a small microscope into the uterine cavity. We will come to know all the problems, and we may come to know the uterine septum also. The septum also can be removed, the polyps can be removed, the fibroid, small fibroid or fibroid polyps are removed. All these things will be enhancing the fertility capacity, enhancing the implantation capacity of the uterus. Why laparoscopy is needed? Suppose in laparoscopy the shape of the uterus will be noticed, and whether it is uniconvate, whether it is biconvate uterus, or whether there is any other problem in the adhesions, or between the tubes and ovaries there is any problem, and whether the ovaries are good, whether the ovaries are PCOS. If the PCOS is there, we will remove some of the eggs by electrocauterization, and sometimes we may require to do the adhesiolysis, and suppose if there is any hydrosalpinx or pyosalpinx, and we may clip the tubes at the proximal levels, so that this hydrosalpinx fluid will not wash out the embryo when we put the embryo into the uterine cavity, that is the endometrial cavity. So these are the few things where we do the certain like good enhancement procedures for the fertility rate, fertility success rate. And then the last and very important is PGS, pre-genetic screening, where in PGS actually we will remove all the abnormal embryos, where we do ICSA procedure, where we prepare the good embryos, where we remove the chromosomally abnormal embryos, where we remove the other genetic defect embryos, genetically defective embryos, where we remove the mutational embryos, where we remove the single gene defect embryos. All these embryos will remove. We prepare very good embryos, and we will put the embryos inside the endometrial cavity. As usual, the enhancement of the success rate will be very high in this case.